Hi, I'm Kris-Etherton from Penn State University, and this morning I talked about the cardiovascular benefits of nuts and almonds. What we know is that cardiovascular disease is a leading cause of morbidity and mortality in the United States as well as globally. And the Global Burden of Disease study conducted by WHO concluded that the number 12 risk factor for cardiovascular disease is inadequate nut and seed consumption. So on the basis of that, we'd like to recommend that people consume more nuts and seeds. And this is a recommendation that's consistent with recommendations made by American Heart Association and the 2010 Dietary Guidelines for Americans. The recommendations are based on a strong evidence base. Epidemiologic studies have consistently shown dose-response relationships between nut consumption and decreased risk of coronary heart disease. In fact, people who consume nuts 5 times a week have about a 40% reduction in coronary heart disease risk. A new study recently published in the New England Journal of Medicine has shown that in addition to benefiting heart disease, nut consumption benefits total mortality in a dose-response way, cancer, and respiratory disease. So there's a lot of good reasons to consume nuts. How do nuts elicit cardiovascular benefits? Well, we know that they decrease total and LDL cholesterol as well as triglycerides in a dose-response manner. We conducted an almond study at Penn State designed to evaluate substituting 1 banana muffin per day for 1.5 ounces of almonds. And with this very simple substitution, we showed that almond consumption resulted in a greater LDL cholesterol lowering effect and no increases in remnant lipoproteins, whereas the banana muffin increased remnant lipoproteins and also small dense LDL cholesterol, a major risk factor for heart disease. Other clinical studies have shown benefits of almond consumption on LDL cholesterol in a dose-response manner. One other very interesting finding that also comes from the Predimed study is that almond consumption decreases waist circumference and visceral adipose tissue. So in addition to benefits on lipids and lipoproteins and adipose tissue, there are other benefits too of almond consumption, including helping to control glucose levels and hemoglobin A1C levels in people with diabetes, benefits on postprandial lipids, inflammatory markers, as well as small dense LDL. So the message is clear: consume nuts and consume almonds for many health benefits. Thank you.